I'm here to talk about ovarian cancer. My name is Nas Ann. Welcome. Ovarian cancer is among the leading type of cancer all over the world that is killing most women. The reason being, it is very hard for it to be detected at its early stage, for there is no specific test so far that can test ovarian cancer and give the results accurately. If the doctor decides to do what we call a protein called CA125, it is possible that it might give a negative or a negative results or a wrong results, because this same protein can be affected by pregnancy, by fibroids, by menses, and so far. If the doctor also decides to do an ultrasound will only be able to show if there is a mass. If he'd say to do a smear test will not be able to give results if there is any metastasis and so far. And therefore it has become very hard for them doctors to give the right diagnosis. If they decide to do a CT scan or MRI, still it is very hard, because it concentrates on the tumors, on the growth, where it is hard when it comes to ovarian cancer, therefore making it very difficult. Another thing is that its signs and symptoms mimics or look like other symptoms that are far from reproductive system, like it gives signs and symptoms of digestive system, like irritable bowel syndrome, gastrointestinal diseases. Therefore, most doctors and patients concentrate on digestive system, forgetting the reproductive system, therefore diverting them concentration, leading to misdiagnosis. Another thing is that it has now changed. It has become more aggressive, like it's now also affecting the younger girls and women as compared to postmenopausal mothers. Maybe diet we are taking, and also so many other factors that are affecting our body now, predisposing us to have ovarian cancer at early stage. Therefore, if the doctor or healthcare provider will concentrate on the age, like you're only 18 or 20 or 30, it is hard for you to have ovarian cancer, they end up missing out this condition. And therefore it is mostly found when it has gone so far, it has metastasis. The only thing here that can help us is depending on the family history, giving the correct family history that will help the doctor to maybe consider going that line to get the diagnosis. Or the doctor might say to do a biopsy. This biopsy will be very important, because it's going to give the right diagnosis. If there is cancer, it's going to give staging and therefore giving direction to the treatment. And let us now try to look at some of the signs and symptoms that are found to be part of ovarian cancer. We have said that there is bloatedness. You feel like you are bloated. You don't feel like you want to eat. You lack appetite. Therefore, it becomes very hard for you to eat and feel comfortable. Another thing, there is abdominal pain and pelvic pain. Although we have said there are other factors that might lead or might cause pelvic pain, like inflammatory pelvic inflammatory diseases, we cannot rule out ovarian cancer. There is also a massive weight loss. Every cancer has weight loss. If you start having weight changes in weight loss, it's good for you to check out. Also, there is what we call irregular bleeding, like let's say irregular bleeding, and maybe you just finish your periods and then a few days you are starting it again. There is irregular bleeding. It's not a good sign. There are other factors that leads to irregular bleeding, like hormonal imbalance, fibroids, and so on, but it is good also to rule out those, but also to consider doing and going for more investigation for ovarian cancer. There is also what we call increased micturition. You feel like you want to pee most of the time. There is increased. We have said that the same hormone of ovarian cancer, of the protein that tests ovarian cancer, can also mimic pregnancy. Therefore, when you have pregnancy, or you have fibroids, or you have anything to do with hormone changes, you end up having frequency in micturition. But don't forget that even ovarian cancer that has protein CA125 can also lead to increased micturition. So if you are not pregnant, you are not having all these like fibroids, who are not having any gynecological condition that might lead to frequent menstruation or any other condition, it is always good for you to consider having a test on the, or talking to your doctor about the ovarian cancer. And what are some of the risk factors? We have said family history is the key here. When you have a family member who were ever diagnosed of ovarian cancer, it is good for you to talk to your doctor so that we redirect our focus and effort on the right direction. Also, if you have been diagnosed with a syndrome called Lynch syndrome, or have a family member who has Lynch syndrome, it is one of the syndrome that predisposes most patients on the ovarian cancer. Not only ovarian cancer, but Lynch syndrome can also predispose you to colon cancer and what we call endometrial cancer and ovarian cancer. So don't rule out. It's good for you to do investigation. Don't forget to like and also subscribe to my channel for more information on these conditions.